Most people think of chiropractic adjustments as only being related to the spine. However, adjustments can be performed in any joint in the body. Freely movable joints that can be manipulated include wrists, ankles, knees, shoulders. We would usually use a wrist adjustment for people who use their hands through a large portion of their day. Along with adjusting the wrist, we will include adjustments of the thumb and fingers. Similar to the drop table, a drop piece is used to manipulate the knee joint. The drop piece also elevates and falls with pressure when the chiropractor puts their hands on the joint. We would use adjustments of the knees in people with chronic pain, people that have had surgeries, or strains to this joint. An adjustment of the ankle involves the chiropractor distracting the bones of your ankle away from your body. In other words, the chiropractor will grab your foot and your heel and pull away from your body, usually achieving a popping sound similar to an adjustment of the spine. Joint fixations in the ankle can be relieved with the adjustment, and conditions such as plantar fasciitis can also be improved with an alignment of the ankle.